Okay, GOSIA Desmond, you're very welcome. Tell us a little bit about yourself.
My name is GOSIA Desmond. I'm Polish. I've been living in Ireland for the last 10 years. I have an Irish husband, so that's the main reason I'm here. I am a nutritionist and a dietitian. I did a master's in dietetics and a degree in nutritional medicine. So what I do is I work in Poland. I actually live in Poland and in Ireland. Travel between two countries. I work in a Centre of Nutritional Medicine, one of the biggest hospitals, private hospitals in Warsaw, where I apply intensive nutritional therapy in chronic conditions like cardiovascular disease, hypertension, diabetes, a lot of autoimmune conditions, but we also work with cancer survivors.
Mm-hmm. So what you're saying is that you use food and nutritional thinking to battle what people would class as heavyweight diseases.
That's correct. Mm-hmm. There is a lot of evidence that lifestyle intervention, including dietary intervention, can not only prevent a lot of the conditions that are actually killing our society, like cardiovascular disease, hypertension, diabetes. Also, we have evidence that about 40 to 50% of cancers could be prevented just by dietary excellence and physical activity. Mm-hmm. But we also have evidence that interventions in people who already have those conditions with dietary change can have profound effects, profound therapeutic effects. And I work with a rheumatologist, cardiologist, internal medicine specialist and an oncologist. We actually apply nutrition along with other medical orthodox treatments, and we get fantastic results.
Very good. I think people would be reassured to hear that the medical profession, like the biomedical model, is on board with this.
Absolutely. I work in a hospital.
Mm-hmm.
It's a private hospital. It's a big hospital. So I work with doctors, with PhD consultants, and these doctors are just maybe more open to the other ways, because unfortunately, in the medical education doesn't really comprise nutrition. Doctors do not learn about nutrition. So if they do learn about it, they have to do it somewhere outside. Mm-hmm. So I was lucky enough to meet people who were aware of how much nutrition can do, and they invited me to work with them.
Okay, and is it your mission to set up something in Ireland that is similar to what you have in Poland?
Absolutely, because we get unbelievable results, and because I live in both countries, I'd like to start doing similar things here in Ireland. Yeah.
Okay, what kind of people come to see you traditionally?
A lot of different types of conditions, but I would call them the main killers of the Western society. So first of all, cardiovascular disease. I get a lot of people with not only heart attack survivors, people who already had some event. I have people with high cholesterol, hypertension, people also with type 2 diabetes. So these would be about 30 to 40% of the patients I see would have those conditions, and they're very, very common. I actually see people my age who come to me, let's say, with something else like rheumatoid arthritis, and we get their blood test done, and I see they have very, very high cholesterol levels. So the cardiovascular disease, the evidence on the effect of dietary intervention and the efficacy of dietary intervention is very, very strong. And I guess about 95-96% of people who come to me and go under those nutritional changes, they actually get profound effects. So, for example, you can lower your cholesterol with diet, and if you apply a traditionally recommended dietary regime, you may lower your cholesterol by about 5%. And this is the agreed meta-analysis. They say the traditionally conventional applied dietary therapies with people with high cholesterol, it's 5% reduction, which is not much.
Yeah. Gosh, you flesh that out for us a little. So if somebody came to you with high cholesterol, and I know everybody's different, but broadly speaking, what would you do? What kind of foods would you advise? What kind of foods would you encourage them not to go near?
It's basically a plant-based diet, but not. It doesn't have to be a vegetarian or a vegan diet, but it has to be a plant-based diet. So the majority of foods they will eat is plant-based, But it's not any plant-based diet, it has to be specific plant-based diet. So I take them off oils or oils completely. I put them on a lot of foods with high soluble fiber, a lot of plant proteins. So let's say if they're eating their meat, that will be mainly poultry and fish, and once, twice a week, 5 times a week it will be plant protein. Loads of fruits, loads of vegetables, loads of whole grains, beans, and very little nuts. So it's going to be a low-fat diet. And the effect of this diet, and it's not only my experience, it has been actually shown in the best medical journals around the world, JAMA, Journal of American Medical Association, Lancet, you can actually lower your cholesterol by about 40% in the first 3 to 4 weeks, and we see this. And in patients with no previous heart attack history, our cardiologist takes them off medications if they do comply, because we have to say one thing: if you want to get significant result, you have to make significant dietary changes. It's a little bit, it's not going to bring this significant effect.
Okay. A typical consultation in your clinic, GOSIA, what would that entail?
Usually what we would do is we would ask a patient to, I would send, or a call center person would send a questionnaire. They will fill out a questionnaire. It's a detailed dietary history questionnaire and health history questionnaire. They send it to me about 7 days before the visit. I spend about 1 hour and a half in preparing the nutritional guidelines for them. So they're going to get exact nutrition guidelines, menu examples and recipes, but also I tell them why they're making these changes. So for example, a big group of people who would come to see me is also people with autoimmune conditions. And unlike with cardiovascular disease, we don't have that much evidence, but the evidence is still there. And evidence suggests that a plant-based diet, but also elimination diet, so gluten-free with elimination of specific antigens. In some people it's corn, some people it's rice, some people it's soya, it depends. Can significantly lessen the pain symptoms, and we see that. So I have to have the whole history, what the patient has been eating before, what drugs they're on, what supplements are they taking. Sometimes they're not taking the right supplements, and sometimes supplements shouldn't be taken at all. Also, I have to make sure if the diet doesn't interfere with the medication they're taking, and also I have to know their weight, their height, the level of physical activity, their history of all the other diseases they have, to combine a very, I'd say, individualized program for them. And then they come to see me, and it's about 14 minutes to 1 hour. And then I ask them also to do some blood tests, because what usually we do, we measure the progress of the therapy by seeing the blood tests. So obviously cholesterol levels, glucose levels in some people, insulin levels, and the inflammation markers like C-reactive protein and all of that. So we measure that before they start the diet, and then I ask them to do the diet for 4 weeks, and then test them again and come back to see me afterwards.
How often do they have to see you?
Definitely the first and the second time, so that's the minimum, and we usually ask them to come after 4 weeks. So it's a month that they get to play with the diet, because most people do make mistakes.
Yes.
So the second visit is absolutely fundamental. They actually have to see me for the second time, because dietary change is difficult. It's not like taking a pill. Some people say it's more difficult than giving up smoking. So they have to be supported in the change, and I'm going to check the next time they come to see me. I always see what they're eating and if they're doing it right.
Do people by and large lose weight as a result of this?
Absolutely.
And do some people come to you with that in mind?
Some people do, but weight loss, it's always a nice side effect of this dietary therapy, because the diet we prescribe is usually a very low, it's high nutrient density but very low caloric density, which means people eat a lot of volume, but in that volume there's not much energy, so they usually lose weight. Even people with normal weight, they get down even to the lower end of the normal range.